Madam President, I rise today to talk about the epidemic in the American workforce, which has wreaked havoc on our labor markets and caused undue hardship for millions of our nation's workers. I'm talking, of course, about the eradication of the 40-hour work week brought by the so-called, quote, Affordable Care Act, unquote. As a result of this poorly named law, businesses around the country are instituting hiring freezes, downsizing their workforces, or reducing worker hours. As you know, the President's health law requires employers with 50 or more full-time employees to offer health coverage of a minimum value or pay a penalty. One of the unintended but not unforeseen consequences of the law is that a number of employers are opting to unilaterally limit the number of full-time employees in order to escape this burdensome mandate. The Affordable Care Act defines, quote, full-time, unquote, employees as those working at least 30 hours a week. As a result of this odd definition, not every employer seeking to avoid paying penalties is laying off workers. Instead, an increasing number of businesses have opted to simply cap workers' hours. This is happening everywhere, Madam President. For example, a recent Reuters survey of 52 Walmart stores found that half of the stores were only hiring temporary workers, something the stores typically only do during the holiday shopping season. According to a recent article in the Washington Times, Walmart has, overall, increased the share of its temporary staff from between 1% and 2% last year to 10% this year. Keep in mind, Walmart is our nation's largest employer, and though the company has denied that this change in policy is a result of Obamacare, it's hard to believe that this is all just a coincidence. Small businesses are also being impacted. For instance, here is the example cited recently. There is the example cited recently in the Wall Street Journal, where Carson Sin, an owner of several Del Taco restaurants in the Denver area, was forced to shift the majority of his workforce from full-time to part-time as a result of Obamacare. Mr. Carson Sin previously had 180 full-time employees and only 40 part-time workers. But providing benefits to these workers would have imposed as much as $400,000 additional dollars a year in additional costs. As a result, he is now in the process of switching to 80 full-time and 320 part-time workers, none of which will work more than 28 hours per week. Like I said, this is happening everywhere. It's stupid. According to a survey conducted by the U.S. Chamber of Commerce, 71% of small businesses say that the President's health law makes it harder to hire new employees. And among small businesses that will be impacted by Obamacare's employer mandate, 50% say that they will either have to cut the hours of workers currently employed full-time or replace their full-time employees with part-timers in order to avoid this vicious mandate. But it's not just happening in the private sector. Public schools, states, and municipalities are also limiting employees to part-time work in order to avoid paying costly benefits. For example, the second largest school district in my home state of Utah recently implemented a policy limiting part-timers to 29 hours a week. According to the Washington Post, this impacted roughly 1,200 employees, mostly substitute teachers. That's 1,200 employers in a single school district that will see their hours and their wages capped as a result of Obamacare. Likewise, the state of Virginia recently enacted a policy reducing the hours for as many as 10,000 part-time employees that, until recently, worked more than 30 hours a week. Offering coverage to these workers would have cost the state as much as $110 million a year. Understandably, rather than paying those crippling costs, Virginia was forced to reduce workers' hours and therefore their pay, thanks to the demands and officiousness of Obamacare. As I stated, this is reaching epidemic levels, and it makes you wonder what is in the brains of those who support Obamacare. Nationwide, employers have added far more part-time employees in 2013, averaging 93,000 a month than full-time workers, which have averaged 22,000. Last year, the reverse was true. It isn't just businesses that are noticing this epidemic. Labor unions, some of the largest supporters of the law when it was originally drafted, have also weighed in on the matter. As has been widely reported earlier this month, the leaders of 3 prominent labor unions sent a letter to the Democratic leaders in both the House and the Senate expressing their concerns about some of the unintended consequences of the, quote, Affordable Care Act, unquote. One of their major concerns was that, in their own words, quote, the law creates an incentive for employers to keep employees' hours below 30 hours a week. Numerous employers have begun to cut workers' hours to avoid this obligation, and many of them are doing so openly. The impact is twofold. Fewer hours means less pay, while also losing our current health benefits, unquote. According to these union leaders, Obamacare threatens to, quote, destroy the foundation of the 40-hour work week that is the backbone of the American middle class, unquote. I couldn't agree more with them. President Obama is apparently starting to feel some of this pressure. Indeed, despite his recent efforts to paint a rosy picture of the impact of the health care law, I think President Obama knows full well that the Affordable Care Act, or should I say, quote, Affordable Care Act, unquote, is not living up to its name. Why else would he decide to delay the implementation of the employer mandate as he did earlier this month? Obviously, there are political considerations. The recently announced 1-year delay on the employer mandate conveniently puts the implementation of the mandate past the 2014 midterm elections. So from that perspective, I guess it makes perfect sense. Setting aside the politics, this delay also makes some sense in terms of policy. The epidemic of employers reducing workers' hours is taking a huge toll on the American workforce. Indeed, the policies established under the health law are killing jobs, reducing wages, and stagnating growth. That being the case, the bigger question is, why is the president only delaying the employer mandate for a single year? Does he really believe these problems will simply go away if businesses have 1 additional year to prepare? Or is he just thinking of the next election and getting his people through that who have voted for this? Regardless of when this mandate goes into effect, it's going to send shockwaves throughout the business community. It's going to eliminate jobs, and it's going to weaken our recovery, weak though it is today. That's why, despite the announcement of the 1-year delay, employers throughout the country are refusing to reverse course when it comes to downsizing their workforces and limiting employees' hours. Most news reports surrounding this issue are showing that this is precisely the case. That's likely the case for the state of Virginia. It's definitely the case for my home state of Utah and Utah's Granite School District, just to mention one aspect of our problems in Utah. If the president is serious about getting our economy back on track, he should work with Congress to ensure this mandate never goes into effect. While we're at it, we should also permanently delay the individual mandate. For the life of me, I can't see why President Obama would extend his limited lifeline to the business community and at the same time leave individuals and their families out in the cold. This is from a president who claims that he's for the families and for the individuals and for the poor and for those who are middle class. They're being left out in the cold. If businesses are currently facing enough difficulties to justify delaying the employer mandate, shouldn't we assume that individuals are going to face similar difficulties complying with the individual mandate? Isn't it only fair that we extend the same benefits to individuals and families that are being offered to businesses and employers? Why not get that beyond the next year's election, too? Not according to the Obama administration. As it stands today, American businesses will get a 1-year reprieve from the job-killing employer mandate. American businesses. But the American people are still squarely in the sights of Obamacare, as the individual mandate for them remains in place. This is the height of unfairness, Madam President, and it needs to be rectified. The House of Representatives, for its part, has acted responsibly. 2 weeks ago, the House passed 2 pieces of legislation, 2 pieces, relating to Obamacare. The first bill would simply codify President Obama's 1-year delay of the employer mandate. And the second would provide similar relief to individuals and families struggling to comply with the individual mandate. Not surprisingly, President Obama has threatened to veto both bills, even the one that would simply put his own administration's policy into statutory form. Still, that shouldn't stop us here in the Senate. Madam President, if we're serious about helping the business community as well as individuals and families, we should work to delay permanently this catastrophic law. If President Obama wants to officially deny the American people the same type of relief he's given to the business community by not working with Congress, then so be it. The Senate needs to act responsibly. If the President is refusing to do the same, we ought at least act responsibly. Make no mistake, Madam President, I don't think that a 1-year delay on the employer and individual mandates is enough. We had to get rid of them both. I'm the author of 2 Senate bills that would repeal both of these egregious provisions of Obamacare. And in light of the President's recent recognition that the employer mandate should be delayed, I have publicly called for a permanent delay of the implementation of the entire law. Given what we know about the problems associated with Obamacare, and quite frankly, given what we don't know, the sensible approach is to delay it permanently and to work together on reforms that will actually lower health care costs. Not just promise to do it, but actually do it. I believe we can fix these problems for everyone, for employers and for individuals alike, but only if the law is permanently delayed to give us a chance to do so. It would give us a chance to be bipartisan for a change around here and work together for the best good of this country. This is what makes sense, and that's what fairness dictates. If we're serious about avoiding what even some of my Democratic friends have called a, quote, train wreck, unquote, that's the least we can do. Madam President, I'm really concerned about our country. We've increased taxes $1 trillion in Obamacare. We've increased taxes $600 billion in the fiscal cliff legislation. And last week, the Majority Leader and others, the President, Majority Leader, Senator Schumer and others, have called for almost $1 trillion more in tax increases. It'd be one thing if all that money would go to reduce spending, if all that money would go to balance our budget. But no, they're going to spend every dime of it. And here we are, headed towards problems that we have plenty of illustrative information on, problems like Greece has gone through and is going through, and other countries as well who just are profligate when it comes to their economic wherewithal. I like the President personally, but for the life of me, as bright as he is, I don't see why he doesn't see all this. And I really don't see why my colleagues on the other side don't see it, or should I say, they ought to see it. They ought to know that this is not what the American people really want. They would like to have health care, there's no question. But this is going to diminish health care all over the country. And as we see, a high percentage of doctors are giving up on Medicaid patients. They won't take them anymore. And now, just this week, a high percentage of doctors is giving up on Medicare patients. They don't want to take them anymore. And what's the administration's answer to all these spending programs? Well, they're going to cut the providers. Already the providers, the doctors, the hospitals, the healthcare providers, are complaining that they can't deliver the services that Obamacare requires at the low-level costs that Obamacare gives. We've got to come up with a better system. We've got to work together. We can't keep going down this pathway. I just hope my friends on the other side will wake up and realize that, hey, this game is over. We've got to find some way to solve these problems because they're just too large. And they're going to wreck our country if we don't. What's worse, they're going to hurt the health care of millions and millions of people who really won't be able to afford it. Madam President, I yield the floor.